Have you ever heard of a virus that's even scarier than Ebola? What if we told you there's an outbreak happening right now that's got health experts on high alert? Imagine a disease that can make you bleed from every part of your body. Sounds like a nightmare, right? Well, it's real and it's called Marburg. Today we're talking about a deadly disease that's been making headlines recently, but chances are you've never heard of it before. That's right, we're exploring the Marburg virus. Now, before you start thinking this is just another scary story to keep you up at night, let's take a deep breath and remember that knowledge is power. The more we understand about these threats, the better equipped we are to protect ourselves and our communities. So let's roll up our sleeves and get into it. What in the world is Marburg virus? Imagine it's 1967 and scientists in Germany and Serbia are scratching their heads over a mysterious illness that suddenly popped up. Little did they know, they were about to uncover a virus that would become one of the most feared in the world of infectious diseases. Marburg virus, named after the German town where it was first identified, is like the evil cousin of the more well-known Ebola virus. They're both part of the same virus family called filoviruses. But here's the kicker. Some experts say Marburg is even nastier than Ebola. So what makes Marburg so scary? Well, it causes a type of illness called hemorrhagic fever. Now that might sound like a term straight out of a medical drama, but it's all too real. Basically, it means the virus can damage the walls of your blood vessels, leading to internal bleeding. And trust us, that's not something anyone wants to experience. The sneaky symptoms. Now, you might be wondering, how would I know if I had Marburg? Well, that's where things get a bit tricky. The virus is sneaky, taking anywhere from 2 to 21 days after exposure to show its ugly face. That's like waiting for a time bomb to go off, never knowing when it might happen. When symptoms do start to appear, they might seem like a bad case of the flu at first. We're talking fever, headaches, muscle aches, and feeling like you've been hit by a truck. But don't be fooled, this is no ordinary flu. As the disease progresses, things can get pretty grim. Some people start experiencing severe bleeding from multiple parts of their body. It's not a pretty sight, and it's definitely not something to take lightly. In the worst cases, people can die within 8 or 9 days of showing symptoms. It's a sobering reminder of just how dangerous this virus can be. The not-so-fun numbers game. Now, let's talk numbers for a moment. The World Health Organization, or OHU for short, estimates that the fatality rate for Marburg can be anywhere between 24% and 88%. On average, about half of the people who catch this virus don't make it. Those are some pretty scary odds, right? But here's the thing. These numbers can vary a lot depending on where the outbreak happens and how quickly it's caught and treated. In places with good healthcare systems, the chances of survival are much better. But in areas with limited medical resources, the virus can spread quickly and be much deadlier. It's also worth noting that some people are more at risk than others. If you've got a weakened immune system, for example, you're more likely to get seriously ill if you catch Marburg. It's like your body's defense system is already struggling, and then this virus comes along to make things even worse. Where in the world is Marburg? Now you might be thinking, okay, this sounds scary, but surely it's not something I need to worry about, right? Well, let's take a look at where Marburg has been popping up. For a long time, Marburg outbreaks were pretty rare. In the 50 years between 1967 and 2017, there were only 13 recorded outbreaks. But here's where things get interesting. Since 2021, we've seen 5 outbreaks. That's right, 5 in just 3 years. It seems like this virus is becoming a bit more active, and that's got scientists paying close attention. Most recently, Rwanda has been dealing with its first ever Marburg outbreak. As of October 2024, they've reported 36 confirmed cases, with 11 people sadly losing their lives to the virus. What's particularly concerning is that a lot of these cases have been in healthcare workers. It just goes to show how easily this virus can spread, even among people who are trained to deal with infectious diseases. But Rwanda isn't the only place that's had to face Marburg. In recent years, we've seen outbreaks in places like Guinea, Ghana, Tanzania, and Equatorial Guinea. These outbreaks have been small, thankfully, but they serve as a reminder that this virus is out there, waiting for an opportunity to spread. How does this nasty bug spread? All right, now for the million-dollar question. How does Marburg virus spread? Well, it turns out that fruit bats are the main culprits here. These flying mammals can carry the virus without getting sick themselves, which makes them perfect hosts. People can catch the virus by spending time in places where these bats live, like caves or mines. But once a person has the virus, that's when things can get really dicey. Marburg can spread from person to person through direct contact with bodily fluids. We're talking blood, saliva, sweat, you name it. And here's the scary part. Even touching surfaces contaminated with these fluids can spread the virus. That means things like bed sheets or clothing from an infected person can be dangerous. It's not airborne, thank goodness, but it's still incredibly easy to catch if you're not careful. This is why healthcare workers are often at such high risk during outbreaks. They're on the front lines dealing directly with sick patients. Without proper protective equipment and strict hygiene measures, they can easily become infected themselves. The hunt for a cure. Now you might be wondering, surely we have a vaccine or treatment for this by now, right? Well, unfortunately, the answer is not yet. As of 2024, there are no approved vaccines or treatments specifically for Marburg virus. But don't lose hope. Scientists around the world are working hard to change that. In Rwanda, where the latest outbreak is happening, they're racing to develop a vaccine. They're not alone in this effort. Organizations like the International AIDS Vaccine Initiative and the Sabin Vaccine Institute are collaborating with the Rwandan government to speed up this process. There's even more good news on the horizon. Remember the team at Oxford University that came up with the AstraZeneca vaccine for COVID-19? Well, they've started trials on a Marburg vaccine too. They're using similar technology to what worked for COVID, so fingers crossed it'll be successful. The World Health Organization is also stepping up, providing funding for vaccine trials. They're working with the Canadian government and the European Union to make this happen. It's a global effort, and it shows just how seriously the world is taking this threat. But what about people who already have Marburg? Well, right now, treatment focuses on managing symptoms and keeping patients hydrated. It's not a cure, but with good medical care, it can help improve a person's chances of survival, staying safe in a Marburg world. So, with all this scary information, what can we do to protect ourselves? Well, the good news is that there are some simple steps we can all take to reduce our risk. First and foremost, good hygiene is key. We're talking about washing hands regularly, avoiding close contact with sick people, and being careful about what we touch in areas where there might be an outbreak. If you're traveling to an area where Marburg has been reported, it's a good idea to wear a mask when you're around other people. And definitely avoid sharing food or drinks with anyone who might be sick. Now, if you think you might have been exposed to the virus, it's crucial to act fast. Limit your contact with other people, keep a close eye on your symptoms, and report to healthcare authorities right away. The sooner you get medical attention, the better your chances of recovery. Why are we seeing more Marburg? Here's a question that's been bugging scientists. Why are we seeing more Marburg outbreaks in recent years? Well, there are a few theories about this. One big factor is that humans are coming into closer contact with wildlife than ever before. As we expand into new areas, we're encroaching on the habitats of animals like fruit bats. And as both humans and animals get more used to being around each other, the chances of disease transmission go up. Another factor is the rise of chronic health conditions like diabetes and heart disease. These conditions can weaken our immune systems, making us more susceptible to viruses like Marburg. And while it's great that people with these conditions are living longer thanks to medical advances, it also means there are more people who might be vulnerable to these kinds of diseases. Lastly, we can't ignore the role of global travel. In today's interconnected world, a virus that pops up in one corner of the globe can quickly spread to others. It's a sobering reminder of how important it is to take these outbreaks seriously, no matter where they happen. The global response. Now, before we wrap up, let's talk about how the world is responding to the Marburg threat. The good news is that global health organizations are taking this very seriously. The World Health Organization is at the forefront of these efforts. They're working closely with affected countries to monitor outbreaks, provide resources, and coordinate the global response. They've assessed the risk of the current outbreak as very high at the national level in Rwanda, high at the regional level, but thankfully low at the global level. But it's not just about responding to outbreaks when they happen. There's a growing push for more preventative measures. This includes things like active surveillance programs to catch outbreaks early, and investing in healthcare infrastructure in vulnerable areas. Well, that's all for today. It's a scary topic, no doubt about it. But remember, knowledge is power. By understanding this virus, how it spreads, what it does, and how we can protect ourselves, we're better equipped to face this threat. If you found this video helpful, don't forget to like and subscribe for more content that cuts through the hype and brings you the real science and health. Until next time, stay curious and take care.